Every newborn baby instinctively learns to crawl, walk and talk. The babies learn all that in different stages of their lives. Some start as early as 3 months, while others may take longer. As a child grows, it is common for the parents or caretakers to teach the child how to use the toilet. This is done routinely to phase out day and nighttime bedwetting.
For example, at 2 years of age, over 60% of children will wet their beds at night. But as they grow older, their bladder gets bigger, they're able to hold urine better.
Dr. Phyillis Kisa says 20% of the children struggle to phase out the habit of nighttime bedwetting, which is normal.
Normally, when the bladder is full, you're able to pass urine or pee at the right time. A child who is 5 years old should pee between 6 to 8 times a day, or up to 10 times. If they urinate less than that, there is a problem. They will damage their kidneys by not going.
She says, as a parent, you will need to worry if your child still wets themselves during the day.
If at any time your child after the age of 2 years continues to wet themselves during the day, look for a solution. That child has a problem that requires more than just waiting for them to grow. Because during the day you are awake and you can tell that I want to go now.
Urinary incontinence can be caused by a number of issues, both medical and self-inflicted. These include accidents and biological malformations like a blockage in the bladder and urethra, damage to the spinal cord, poor coordination of the brain and the bladder, low production of antidiuretic hormone by the body, infections from diseases like malaria, and irritation to the bladder by infections due to long storage of urine.
The bladder does not contract when it should, so it starts doing something like that. It says an abnormal reflex in the bladder. It doesn't relax well and just contracts whenever it wants to.
Many parents have seen their children wet themselves as they play or watch movies that distract them from answering the call of nature. But such a habit can be harmful if left uncontrolled.
This starts that cycle of denying the bladder the reflex. The brain says it is full, go and urinate, but the child says, no, I'm still playing. So it disorganizes that reflex, and also because urine stays there for long, they get that bad reflex in the bladder. So the accidents start, but also infections start, and then it becomes a vicious cycle.
This will result into less discharge of urine, which also leads to bacterial growth and back pressure.
Then the damage starts. And then infections also go back because of that back pressure. Urine goes with infections up to the kidney. Sometimes the tenseness in the opening of the bladder, we call it the sphincter, because it does not relax and now there's discoordination, it also affects the sphincter in the stool system as well. So these children start getting constipation.
She says the side effects of retaining urine in the bladder are not painful until one has an infection.
Because you're not urinating, you're not washing out any bacteria that might have gotten into the bladder. So instead they go in that direction. When they go in that direction, you start getting irritation in the kidney and you end up with an infection. That is painful. Sometimes they may get what they call spasms, and those are painful.
Dr. Kisa says if the child does not heal from wetting naturally, then medical help should be sought.
And it may require a physical exam. You examine them. Then you may require a specialized X-ray or an ultrasound. Sometimes you have to use a telescope to look into the urinary system to see where the problem is.
Surgery is always recommended for a child with malformations, and medical advice on how to handle the situation in lazy bladders.
We operate to either remove a stone in the bladder, or we operate, again using the telescope, to open this bag of urine so that it drains out and it remains open, and then it's flat. So now the bladder no longer senses that there is a problem inside there. But also, don't push them. So at that time, we assess what the actual problem is and give you a stress-less way to manage the children without making them worse. Some operations require for us to go and remove the narrow part of the urethra.
Consuming of acidic foods like oranges, lemons, plus taking their juices, and eating spicy foods are contributing factors to this condition of urine incontinence. Now, Dr. Kisa, here at the School of Health in Mulago, advises that even if the condition is medically treatable, natural means can be used to solve this problem. She says taking large amounts of water during the day can help the body maintain a systematic format on which to release or to hold the urine in the bladder. Walter Mwesigye, NTV.